All right, and welcome to this edition of the Native News Update on this Thursday, June 24th. I'm your host for today's program, Paul Demain. Some of the stories read here can also be found at our website at IndianCountryNews.com. Here are some of the news stories for the day from the Associated Press and other Native news sources. Teams and sponsorships are still available for the LCO College and WITC second annual Golf 4 Scholarships Tournament on Friday, July 9th at the Hayward Golf Club. The tournament, which raised over $4,000 for Hayward area residents last year, was one of the top two events of the premier golf course, according to Dave Blake at the Hayward Golf Club. Blake said more than 100 golfers played an 18-hole scramble with a wide variety of skills level, some who took it very seriously and others who just came out to enjoy a fun day of golfing on a sunny day. This year, Denise Patrica from Travel Leaders in Hayward will sponsor a $3,000 trip for the hole-in-one prize. There will also be a $1,000 putting contest sponsored by Bill Meyer, owner of Wild River Sport Marine in Trigo. The cost of a hole sponsorship is $100, which puts an individual or business's name on the hole marker and visibility in all kinds of media. To register a four-person team or to sign up as a sponsor, you can contact Lynn at 715-634-5167, and we're going to put her email up here at the LCO Community College as well. And we have the Minnesota House File 1231 mandated the statewide Dakota and Ojibwe language revitalization volunteer working group to develop a unified strategy to revitalize and preserve indigenous languages of the 11 federally recognized tribes in Minnesota. This work group is commissioned from September 1st, 2009 through February 16th of 2011. The group has distributed a questionnaire volunteer working group to assess community interest in Dakota and Ojibwe language immersion schools and programs and the current status of the Dakota and Ojibwe language by tribal members in Minnesota. The information you share will play a vital role in preserving your nation's language and culture, and if you'd like more information about that questionnaire, you can contact Pamela Standing at 218-847-9545, and we're going to put her email on the roller up here so you can contact Pamela about that questionnaire. Estimated time to complete the questionnaire is 15 to 20 minutes, and they need to get them done by July 31st. And today we discuss a little bit more of the issue of healthcare with Mark Trahan, who's been studying Indian healthcare and related issues around the United States for the last year. Mark Trahan, you've been looking a little bit at primary care here in the last month as part of your research of the American Indian healthcare system as it particularly pertains to American Indians. What are you finding out?
Well, in the Indian health system, there's a long history of using non-physicians for primary care. It ranges from licensed nurse practitioners to physician's assistants to pharmacists for particularly for diabetes treatment. And that's been really helpful because it expands the number of people that can be seen by the IHS.
That helps in terms of avoiding the doctor, but is avoiding the doctor and having someone else do the diagnostic stuff, is that it maybe saves money, but is it considered quality care?
Absolutely. In fact, the data suggests that it's better care because you get more attention. The person dealing with you is likely to spend time with you, listen to you, not be rushed off to the next appointment. We hit this in a real personal way at home with our first son, who was born at Fort Defiance Public Health Service, where the entire process was through nurse midwives. And then when our second son was born, it was at a contract healthcare off-reservation facility. We saw the doctor for just a few minutes. It was hurried, never very personal, and the experience without the doctor was much better.
Some of these healthcare providers, maybe you can just move back just a little bit too. There you go. Okay, good. Some of these, you're saying that some of these interim people, before you get to the doctor, might understand who and what you are about, have a better picture of your healthcare records than the doctor coming through.
Right, because they have the time. They're not quite as rushed as the doctor, and that's the primary difference. And the training is good. We're talking about people essentially with master's degrees rather than doctorate degrees. So the level of training is not beyond measure.
Right. Now, have you come across any statistics about how those ratios work in Indian country as compared to other areas of the country? Are there other facilities that are reliant much more heavily on these intermediaries rather than the primary doctor?
Yes, in general, Indian country uses it at a higher level. Although I would have to say that the rest of the system will be doing that as well. That's the future. One thing that's going on right now in Alaska that really stretches it is an oral health program where they take people right out of high school, give them 2 years of intensive training, and then they become dental health therapists and work directly with patients, do extractions, do some of the things that help with that dentists normally would do.
Is there a place for traditional therapies and wisdom? Some people call them medicine men. Some of them, it might be the midwives and stuff like that. Is there a place for traditional medicine in that whole hierarchy?
Absolutely. And I think the Indian health system, both the Indian Health Service itself and tribally controlled facilities, have been pretty good at keeping their ears open to listen to ways that might be effective.
Do you ever hear of doctors saying, really a lot of this healthcare stuff almost is a reflection of the patient? I've had a doctor tell me one time, wow, it seems like you really know a lot about what's going on. There's a lot of self-diagnosis, self-awareness. Right. Where in the system can people learn about that? I mean, if they're not aware of their own self, women come in and they're, been pregnant for, 60 to 90 days and they didn't even know it, kind of a thing.
Definitely, that's something to pay attention to. And in the future, I think there's going to be a lot more emphasis on that. And again, I use this a lot, but the most expensive disease in America is diabetes. And that's a disease that you can self-manage.
And there's a lot of people walking around with symptoms and signs of that without doing anything about it.
Exactly. And then it gets too late when they do something about it.
Where are you going with your research after this, Mark?
Well, the good news is my fellowship was extended through the summer, so I'll be writing all the way through August, and I'll kind of figure it out at that point what to do with it.
Okay, and people can find your columns where again?
www.marktrahant.com.
And if you were to capsulize what you've seen in the last year out in Indian country and elsewhere, how would you capsulize it all down as a big picture?
That the Indian health system has challenges, but it's better than people give it credit for.
And have you been able to look and compare that system against anything in Canada or Europe or anything in any intense way?
Not in an intense way. Data-wise, it's comparable. It's hard to separate out, though, the historic diseases that affect Indian country in greater numbers. And the good thing is those diseases have been in a decline, but the rate of decline isn't nearly fast enough.
You use Indian Health Service on a regular basis?
I will now. I just moved home.
Oh, have no fear. And where's back home? You're back on your home reservation.
Yes, Fort Hall, Idaho.
Well, we want a very in-depth report on how you're treated down there and all the ideas that you're going to help them implement here in the near future.
Very good.
Thank you for joining with us, Mark. We'll catch up with you in a couple weeks again and have you do another report.
Sounds good.
And that is the latest roundup of news from Indian Country. On this edition of the Native News Update, we want to thank you for joining with us. Come back again soon.